Welcome to the Midnight Medical Coding Podcast, where we talk all things medical coding. My name is Lindsay Della Vella, and I'm a medical coding instructor, and I created this series to educate people who are interested in medical coding, and it's also geared towards medical coding students. You'll hear a series of discussions that will break down essential concepts, tips, and strategies to help you along the way. And just so you guys know, the voices you hear are AI generated, but it's based on my social media content and website, so you can find similar information there. Okay, let's get started.
Ever get a medical bill and feel like it's in a whole other language? Like some secret code only doctors and insurance companies understand.
I think we've all been there.
Right. Today we're diving deep into two little codes that can make a big difference in how much you pay. We're talking CPT modifiers 26 and TC.
Ah, the mysterious world of medical billing.
It is a bit of a mystery, and these codes pop up all the time with diagnostic radiology. X-rays, MRIs, those kinds of things.
They're all about figuring out who gets paid for what, right?
Exactly. But before we get lost in the weeds, can you give us a quick overview of CPT codes in general?
Sure. Basically, CPT codes are how doctors and hospitals tell insurance companies what services they've provided. Each code matches up to a specific procedure or service.
So like a secret handshake, but with numbers?
Kind of. And those codes determine how much the insurance company will pay.
Makes sense. So let's say I'm going in for an X-ray, right? What's happening with these codes, 26 and TC, behind the scenes?
Okay, good question. Most radiology procedures have two main parts: the professional component and the technical component.
So like a restaurant.
Right.
You pay for the food itself, that's the technical part. But you're also paying for the chef's expertise to, create it. That's the professional side.
Perfect. And now, in radiology, the radiologist is our chef, right? They analyze the images, give you a diagnosis.
Right.
Modifier 26, that's their code. It's how they get paid for their expertise, their knowledge, actually reading your X-ray, not for the X-ray itself.
So Modifier 26 covers things like them looking at the images, writing up the report, stuff like that.
Absolutely. Supervision, interpretation of the report, all of that.
Okay, so two people, two X-rays. One's at a big hospital, full radiology department, the works.
Right.
The other's at a tiny doctor's office that just happens to have their own X-ray machine.
Okay, I see where you're going with this. That hospital scenario.
Yeah.
Classic Modifier 26. Because you're billing the radiologist's expertise separately from the hospital services.
Fascinating. Okay, so then what about Modifier TC? Where does that come in?
That's for the restaurant itself.
Uh-huh.
Modifier TC makes sure the facility that actually owns that X-ray machine, whether it's a big hospital or that small doctor's office, they get reimbursed for using it.
So it's not just the machine, right? It's like the cost of running it, the staff?
You got it. The equipment itself, the technicians running it, all the supplies. It all falls under Modifier TC. That's actually a big reason medical bills can seem so incredibly itemized. They're separating out every little piece.
Wow, okay. This is blowing my mind.
It's complicated.
It really is. So let's say a place has its own radiologists on staff, right? And they own all their equipment. Would they still use both modifiers?
Nope. If it's all under one roof, so to speak, if one entity employs the radiologist and owns the equipment, they'd bill it all together. Think of a standalone imaging center. They often have their own radiologists and equipment, so you wouldn't see separate Modifier 26 or TC charges on your bill.
This has been so eye-opening. So next time we're staring down a medical bill, maybe feeling a little confused.
Happens to the best of us.
Right. We can remember these codes, 26 and TC, and have a better understanding of what's going on. Who knew there was so much behind those two little codes?
It's a whole world of billing out there.
All right, guys, thanks for listening. To learn more about medical coding or medical coding courses, remember to check out my website, midnightmedicalcoding.com.